Joined by Missouri Senator Roy Blunt, who's in Washington today dealing with all of the fallout from the health care bill. Senator, how are you?
I'm good, Mark. How are you?
I'm doing well, thank you.
I do think the bill you just mentioned, the president signed, we've also passed a bill that creates more options and more choice for veterans. I got a bill passed, the Hire Vets Act, that the Labor Department is going to set up a recognition standard for companies that hire, promote, give credit for veterans for as they've learned in the service, kind of like the LEADS standard, except you'd be more than just.
Senator, you there? Senator Blunt? If he's in the bowels.
Are you?
Yeah.
Are you not hearing me, Mark?
No. You cut out there for just a minute.
All right, maybe I'm permanently back here. I'm actually in the car for a minute, which normally works.
Okay, that's fine.
Hopefully it'll work again today.
We missed the tail end of what you said about the VA bill, though, but it does seem like a lot of administrations have kind of paid lip service to this, but quite a bit's been done in the last couple of months.
I believe that's right, and I was mentioning a bill that I was the author of that the president has signed also that recognizes employers for their efforts to hire and promote and recognize the skills veterans receive while they're in the service. Lots of things like that are happening. Lots of regulatory changes are being made in a way that eliminate needless regulation. Those are the kinds of things that neither the president nor the Congress is getting any credit for. I expect that will continue to be the case, but our friends need to understand that those things are happening and happening every day.
Well, I'm glad to hear that because they don't make the headlines very often. That's for sure. All we hear about is things that aren't working. What's your take on the health care bill that the Senate has rolled out now?
I think it's a significant step in the right direction. This is a multi-step process. It would be a lot easier to do this if we weren't in a healthcare system that was collapsing around us. This is sort of like you're trying to stabilize a building and build a new structure in the middle of a collapsing building. We need to understand why we're where we are. The Democrats, of course, don't want to talk about Obamacare any longer. They want to somehow say all of these problems are new problems. They're not new problems. Companies have been abandoning the insurance network. They no longer want to offer policies because the Obamacare structure won't work. I think this is a step in the right direction. Step two would be the Secretary of Health and Human Services looking at the more than 1,400 places in the Obamacare law that said that department or some other department, generally that department, will define what this really means. I met with Secretary Price this week. He said, we're going to look at every one of those, and everywhere we can do this in a way that saves money for families and gives them more health care choices, we're going to do that if we can in those 1,440 rules.
Yeah, that seems to have been overlooked because I know when the House version of this rolled out, the administration was very clear that it was the first part of a three-part plan.
Right.
And that kind of got lost, I think, when the Senate draft was rolled out yesterday. So
it did, and so the Senate draft does everything we could do with 51 votes in the Senate. The Secretary then gets to do what he can do with rules and regulations, and then hopefully we can come back and in passing new law, make it easier for people to get insurance at work, easier for people to buy across state lines, easier for people to become part of a network of some kind that allows them to be in group insurance rather than individual insurance and with the same tax benefits that you have if you get your insurance at work.
Yeah, if I can switch gears for a moment to all of this talk of investigations, that seems to be what everybody focuses on every day. The president seemed to praise Bob Mueller yesterday, and he also seemed to be a little critical of the process at the same time. What's your take on how this is moving forward?
Well, I'm on the Intel committee, and so that's almost been a full-time job since the inauguration itself. I will say that, the best investigative agencies in the world, or purportedly the best in the world, have been looking at this for over a year now and haven't found any evidence of collusion between the campaign and the Russians. There's no doubt the Russians were involved in our election, just like they were involved in the French election, and they are already involved in the German election for September. This is not new. We should have been expecting it, and frankly, the Obama administration should have been more prepared to be there in ways that could have better secured the voter registration systems and others. Nobody thinks the vote counting systems were impacted by this. I think the president needs to get more fully focused on everything else he's involved in and let the investigation go however it's going to go. I think that the president is well served by a full investigation where everybody you'd want to talk to is talked to and everything you'd want to see is seen. And the president's view would be that will give him the clean bill of health he needs. So if I was him, I think I'd stop talking about it and start talking about everything else.
Yeah, I think a lot of people probably share that point of view. Senator Roy Blunt is our guest. Today, Fox News is reporting that your Senate Intel Committee has launched an investigation into former Attorney General Loretta Lynch. Is there anything you can tell us about that?
Well, I couldn't tell you about that if it was happening.
Okay.
I will tell you that I thought in the public event that where I asked and others asked questions of former FBI Director Comey, I thought his conversations about Attorney General Lynch were very troubling. Her telling him how to characterize an investigation so it didn't sound like an investigation. And then, frankly, Mark, him willingly go out and doing that, saying he thought the press would figure it out anyway, so why did you want to fight about this? It seems to me that he does not have nearly the stamina that somebody as experienced and smart as he should have had in dealing with people like Loretta Lynch.
Yeah. Well, that's good. I appreciate your comments on that because I know some of it's probably not something you can confirm or deny there. So I appreciate that.
Well, you've got the Comey meeting. You've got her meeting with President Clinton. You've got all kinds of things going on there that people are generally aware of. That there's a lot of evidence there that I think something that could easily be looked into.
There's been some. I'll let you go after this, but there's been some discussion about whether or not Congress might consider working through the August recess. Have you heard any more on that when it comes to budget deals and the like?
Well, certainly I'd be glad to do that, and that's the right thing to say, and it obviously is what I would want to do anyway. To do that, you have to have all of our members willing to show up and be there every day. And when you only have a margin of 2, sometimes that doesn't happen. The last time we tried to work on Saturday, one of our members had scheduled surgery on a Saturday, almost sure that we wouldn't work, and it was surgery he had to have. So you've got to work around a lot of things to get this done. It doesn't do any good for 48 of us to show up.
Right.
All that does is potentially prove that we're in the minority. Certainly we're in the minority of 47 of us show up, and all of them show up. So that's you've got to be sure that works. I don't think the problem is not spending enough time at home with constituents. I think the problem is just working when we're here and getting focused on what really needs to be done. The Democrats have been dragging their feet on everything they could and turning to this Russia investigation every minute they had to cost the president and the Congress really the most valuable time you have, which is the first 8 months after the election. That's going to get away from us here without the kind of legislative successes that I think the president should have had and we could have had with normal cooperation from the other side.
Yeah, agreed. Senator Blunt, I know Senator McConnell said something about wanting a vote on health care. Do you realistically think that happens before the July 4th break? Well,
2 or 3 things have to happen for that to happen. We have to have a a score of what this costs for sure, particularly the way we're doing it. We have to know that there's savings involved to do it as a budget item. I think we should go ahead and vote. This is one of those things that members have been talking about this for 7 years. It's a 140-page bill. It's not a 2,300-page bill. They should be able to make up their mind, and I think that now is the time to make this decision and find out where members are and see what we need to do to get on with other work and to continue to work to make health care access better for families in Missouri and everywhere else.
Senator Blunt, thanks for your time, and have a great weekend.
Hey, good to talk to you, Mark. I hope to see you soon.
Yes, sir. Thank you. Senator Roy Blunt there joining us live from Washington, D.C. He pointed out something that I'd misspoke on earlier because, of course, we heard Wolf Blitzer complaining about the 140-page Republican bill. It was a 2,300-page Obamacare bill, not a 1,200-page bill, as I errantly reported there at the top of the hour. Wow.